What's up, beautiful people? Another day, another study. Diabetes is something that we treat a lot of in primary care, and unfortunately, rates of diabetes continue to increase. It's estimated now that nearly 15% of US adults have diabetes, according to the CDC, and this increases with age to where people over 65, nearly one in three, 30% of people have diabetes. And diabetes increases the risk of several physical and mental health conditions, including cardiovascular disease, kidney disease, Alzheimer's disease. And lifestyle modifications are a core principle in the management of blood sugars and also the possible remission of type 2 diabetes. Unfortunately, physical inactivity is prevalent in individuals with diabetes. It's increased risk of morbidity and mortality. Physical inactivity worldwide accounts for approximately 7% of diabetes cases. This study tried to estimate the amount of diabetes macrovascular complications, things like cardiovascular disease, heart disease, strokes, in people with diabetes, and they included retinopathy, which is diabetes affecting the eye. So, globally, about 5.5% of macrovascular complications and 9.7% of diabetes-related retinopathy were due to physical inactivity. And for most of these studies, physical inactivity was defined as not meeting that 150 minutes of moderate exercise or activity a week and not meeting or 75 minutes of vigorous activity a week. Stroke had the highest percentage. It was 10.2% of diabetes-related stroke was attributable to physical inactivity. And then women had higher PAFs than men for diabetes-related complications. And then data from the US, because this was worldwide, so looking at data just from the US, physical inactivity was prevalent in 33.7% of the patients with diabetes. And this accounted for nearly 9% of heart failures. And then it went up to like 12.6% of stroke and then 12% of retinopathy. So this is why whenever I'm talking to people about blood sugar control, the first two things I talk about are exercise and nutrition, prioritizing fiber, whole foods, getting enough protein in, meeting our nutrient requirements, lots of polyphenols and other beneficial antioxidants and fruits and vegetables, that kind of thing. I think it's so important that people with diabetes, we get them to understand that moving their bodies with intention, because leisure time physical activity tends to get better results in studies than physical activity related to daily activities. So getting in that leisure time physical activity is very important for blood sugar control and possibly inducing remission of type 2 diabetes. Now, limitation in the study is they didn't differentiate type 1 versus type 2 diabetes in the trials. So they are different ways that we treat these things and different ways we have to think about these things. So that's important. It was observational. It was self-reported physical activity, which means that these effects are probably underestimated. The effect sizes are probably larger because people tend to overestimate physical activity when it's self-reported. Better estimates are when it's actually measured through some type of device. You get more accurate results. But either way, take home, get your body moving.